So I'll start with the research directory of literature. Basically, at this point, we found over 300 different articles that involve, at the least, Asian Pacific Islanders within the cohort of participants, or at least an Asian Pacific Islander researcher who represents the community and has worked within the community or community in other communities. And basically, we found some of the major issues, the major communities that were found in the literature were Filipino, Chinese, and Vietnamese, which is what we would expect, and actually Korean, because that matches the demographics here. Korean, not necessarily, but there's been a lot of research money that's been put into an office who's working directly with Koreans, and so that's given us a wealth of information about Korean health, particularly smoking and smoking cessation opportunities. With that, we found there's a lot of gaps in the literature. One specifically is that refugee health has kind of been left to the wayside. It used to be when the refugee populations originally came, there was a great deal of interest in the research community. But since then, that's tapered off, so we don't get to see any of the long-term health outcomes of these people, which now represent a rather significant proportion of our population, particularly of the API population. We did find that there was a lot of literature that leaned towards mental health, but nothing very specific, and unfortunately there were only 20 studies in general that targeted any health topic as far as interventions. So only 20 studies working with APIs that actually showed programs that could be implemented to improve the community versus just looking at factors related to poor health outcomes or health issues. So overall, we have somewhat of a picture now of where we need to go within these communities and what we need to be doing, which is definitely more intervention-based studies and some more focused studies in terms of specific issues like mental health, but a little more specific, post-traumatic stress disorder, things of that nature that are going to be bigger among the community. We have a great deal of obesity research here in San Diego. APIs have not really been a part of that yet, so there's a lot of opportunities for them to get involved and for us to target the needs of the community, but so far that's still very broken down among the research. It's not cohesive at all. The study of Asian American health. They held their annual conference, and we were asked to present, and so I was fortunate enough to be able to go and talk a little bit about our project and what I found very interesting. One, I think they could be a model for us as far as where we're going now, and particularly what we found among students, and looking for ways to conduct research that, you know, when your budget's limited, you have students who are there and ready to go out into the field. What we're doing here in our project was very unique. There was a lot of incredible research at this conference, but not a lot that went from a different angle in terms of community building and participation, and maybe not necessarily targeting a specific health outcome such as cardiovascular disease, but looking at what does the community need and how can it be implemented amongst local researchers and providers. So I think with that we have something very innovative that, again, can continue to be improved. I thought it was really amazing that I got to hear the Assistant Deputy Director of Health for Obama, who himself is a Korean immigrant. He spoke, and it really spoke to me of someone who came from the community and who is now taking every day of his life that was an experience and who he is to promote health and the fact that health should be a human right in the community. And I think that what we're doing can continue to facilitate that hope. So. So the first year of our project here has been, I feel, especially on our part, we've felt really successful with what's been implemented. One finding that we had that I think is going to really help develop and push the network into the future is the success that we've had working with training and just utilizing Asian Pacific Islander students in the health fields. We had a really positive response from San Diego State, from University of California, San Diego, with students from the community who have never had the chance to be involved working in their community and making a difference there. And most of these are students who want to pursue higher education, so eventually they will be the researchers conducting the research. And to have them at the grassroots level now, they were completely a part of this project on our end in terms of collecting the information, writing the report, entering the data. Every step, they worked alongside myself. And so there was never, they were always able to bring their own person put, which was very important, I think. And so this year we're continuing with that, and we moved it to Samahan, and we've extended it from SDSU to University of California, where we've just, in a very short period of time, we've received an incredible amount of response, and we really kind of went blindly into looking for these students, but it's been very successful. So I think continuing to utilize those students to continue to collect the literature and to really go out now and canvass the community as far as providers for the provider network, because what we were not successful in was getting a lot of people on board for the resource directory. Obviously, these agencies are very busy. They don't have a lot of time to fill out a survey. They don't 100% understand what we're about. So until we get our name out a little bit more, they're not going to be as willing to come on board. But with students who are members of the community, going to them, particularly the more local providers, whether it's a grocery store that provides remedies or it's a small clinic like a dental clinic, we really need a student to go in and present the network and present what we're doing and bring them on board. We're also going to use that opportunity to implement another survey to find out really more specifically what services they're providing that could be particularly useful for APIs, because that was something we struggled with initially. When you say that you provide services, what does that really mean? Does it mean you provide an interpreter, or does that mean you have bilingual, bicultural staff on site who have been educated in health fields? So I feel really optimistic, and I think the network can only continue to move forward based on this, and particularly based on the help of these students who are very passionate and committed to the community.
For more information on the Asian Pacific Islander Community Health Network, please visit our website at www.sdapi.org.